Thank you very much for joining us today. What can you expect from this webinar? Well, the first thing that we'd like to talk to you about is the REACH restriction process. I'll give you some basics on this that will help you understand the proposed restriction on baby diapers. Then we'll go into a bit more detail about the proposed restriction itself, and also, very importantly, how you'll be able to contribute to the ongoing development of this proposed restriction during what we now call opinion making. We will also be able to answer any specific questions that you have by means of an interactive Q&A session at the end of the presentations. I'll now go into a bit more detail on the program itself. So the opening part of the information session will be an introduction to REACH, which I will be presenting. Then after about 20 minutes, I'll hand over to the dossier submitters for the proposed restriction, which is Furans, and Céline Dubois and Karine Fiore from ANSYS will walk you through the restriction proposal itself and the underpinning analysis. After their presentation, which is also of about 20 minutes, I'll hand over to my colleague Sanna Hendrickson at ECHA, and she will introduce the public consultation and the specific questions that will be posed within the consultation and how you can go about answering them. After Sanna is finished, I'll then finally hand over to my colleague Bastian Ziegler, who will give a bit more of a technical introduction to how the consultation is set up to work on the ECHA website and how you can, from a practical perspective, go about making your contribution to the consultation. From 12 o'clock to 1 o'clock, the webinar is open for Q&A, and I will give you a bit of information now about how the Q&A will work. So now that the ongoing session is happening, a Q&A session at slido.com is open. And you can now navigate to slido.com and type in the event code diapers 2021, and that will allow you to submit questions between 11 o'clock and 1 o'clock Helsinki time today for us to answer in the interactive Q&A session at the end of the webinar. So it's a text-based Q&A session, but if you type your questions into Slido now, once the presentation is finished, the team will be available online to answer those questions, and those answers will be visible to all of those that are logged into that Q&A session. If we're not able to answer your question today, then please resubmit your question using the contact forms here. Just to reiterate a little bit on the materials that will be published. So the video recording that you're watching will be available again to watch again at your own leisure. The presentations that we're using will also be available to download. And then after the meeting, we will summarize the Q&A discussion into a Q&A document, and this will be available for you to download. Everything will be available at the webinar pages on the ECHA website. So you just need to search for the details of this webinar again. And then after a period of a couple of weeks, the video recording, the presentations and the Q&A will be available. The recording and the presentations will be available much sooner than the Q&A. So please check back whenever you need to get these materials. So moving on to the REACH restriction process, I'd like to give you a very brief introduction to how this works in case you're not familiar with it. Essentially, restriction under REACH. REACH is the EU chemicals legislation, and restriction is one of the elements of this. Restriction is a tool essentially for protecting human health and the environment from the risks posed by chemicals. And a restriction is usually a limitation or a ban on the manufacture, placing on the market, or use of a substance or a group of substances. A restriction doesn't necessarily comprise a ban. In some cases, a restriction can set out specific conditions, such as the technical conditions under which a substance can be used to ensure that that use is safe, or it may be a labeling requirement, for example, on how best to use that substance in order to control the risks. Importantly, restriction can be applied to any substances, either on its own or when that substance is in a mixture, or where that substance is contained within an article. And an article can be a baby diaper. Importantly, the substances do not need to be those that are required to be registered under REACH. A REACH restriction can apply to other substances such as polymers, medicines, or cosmetics, which are outside of the REACH registration requirement. This is because REACH restriction is intended to function as a safety net to be able to control risks of substances where it's not possible to control these under either REACH or any other relevant EU legislation. If you're interested in the REACH restriction process and you'd like to look in more detail, then you can follow the links at the top of this page, and that will take you to further details on the ECHA website. Here is a very simplified representation of the restriction process. It's split into 3 phases. The first phase is the preparation phase. This is when either ECHA or a member state considers that there's a risk from a substance and they prepare a restriction proposal. We've now gone beyond this phase for this restriction that we're talking about today, and we're talking about these 2 phases here. So after submission of the restriction proposal. And these are the phases that we refer to as the consultation phase and also the opinion development phase. And I will go into a bit more detail on those now. Importantly, what the work of ECHA is not a decision. We are providing a scientific assessment of the proposal. And this assessment, along with the proposal, is sent after it's concluded to the European Commission, where they will decide on the implementation of that restriction along with the member states. Just to reiterate phase 1 of the process, very briefly, a member state or the Commission or ECHA may have a concern that a substance or a group of substances poses a risk either to human health or the environment that isn't controlled. And if a member state or the Commission or ECHA concludes that a restriction is the best way forward to address the identified risk, it has to notify its intention that it's preparing a restriction proposal on something called the Registry of Intentions. And France, who made the proposal on the substances in diapers restriction, had notified their intention to submit this restriction proposal on the 9th of October 2019. So this restriction has been notified for at least 12 months. Now, after notification, France moved into developing the actual restriction proposal, which is in the format of what we call an Annex 15 report. So after notification, they developed this report that has to include various elements. It has to include information on the substances that are intended to be restricted and their hazards and the risks posed by those substances in the specific mixtures or articles which are considered of concern. There needs to be a justification for action at an EU-wide level, REACH, of course, being a harmonised regulation across the whole of the EU. The dossier submitter needs to include information on the availability of alternatives to the substance which is being proposed for restriction. And the Annex 15 report must also include an analysis that demonstrates that the restriction is the most appropriate regulatory tool to address the identified risk. The restriction proposal can also include an analysis of the socio-economic impacts of the proposed restriction. And just to confirm that France submitted their restriction proposal to ECHA on the substances within the scope here, nappies, on the 9th of October 2020. So this is a year after they'd notified it to the registry of intentions. So now formally we enter what we call the consultation phase and the opinion making phase, and our work at ECHA really starts. And essentially it's an evaluation phase. The evaluation is undertaken by two committees here at ECHA. The first committee is the Risk Assessment Committee, the RAC, and they will be looking at the risk-related elements of the proposed restriction, including its effectiveness to address the identified risks. The second committee, which is involved in the evaluation of the proposal, is the Committee for Socio-economic Analysis, which we also refer to as SEAC. And they are looking at the socioeconomic impacts of the proposed restriction in terms of the net benefits to society from addressing the risks, but also the net cost to society from implementing the restriction. So, for example, if certain products would no longer be available on the market because of the restriction, what would the alternative products look like? What would their performance be, for example? And this is important information for the decision maker when eventually they need to decide on the implementation of this restriction. So the starting points for the evaluation are the Annex 15 report that's submitted, but very importantly, the REACH restriction process includes various consultations of interested parties, and the information submitted by those interested parties is taken into account by both committees when they write their opinions on the proposal. Now, just a little bit of extra detail on the timeline now moving forwards on this evaluation. The restriction proposal is made available. We call this pre-publishing on the ECHA website shortly after its submission, so about 2 weeks. So this restriction proposal has been available on the ECHA website to be downloaded and looked at by interested parties for a number of weeks now. The opinion-making process will take typically 12 months, so it's a long process. There's a lot of time available to consider information, and it starts with a 6-month consultation after the dossier has been formally agreed by the RAC and SEAC to be in conformity. So it contains the minimum information set out in the REACH regulation to be considered as a restriction. And this consultation started on the 21st of December 2020, and it runs for 6 months. And this webinar is designed to support interested parties to make their contributions to this consultation. So the evaluation of this proposal by the RAC and SEAC is set out in a document that we refer to as an opinion. And this is why we are in the opinion-making phase. There is an opportunity for a second consultation. This is a 60-day consultation, so very much shorter than this first consultation that is ongoing now, and it is only on a portion of the evaluation, and it's actually on the SEAC draft opinion. So SEAC will publish their draft opinion at the same time that the RAC publish their final opinion at month 9 of the evaluation, and then this is then subject to a 60-day consultation on how they've evaluated the impacts of the proposed restriction on society. After that consultation, then the SEAC will take into account any comments they've received and update their opinion to a final opinion, at which point the opinions are collated from the RAC and the SEAC, and they're sent to the Commission along with the proposal itself for decision-making phase with the member states. So we're very much at the start of the evaluation, and we very much welcome submissions during the consultation. They are very important to the overall opinion making and can very much influence the opinions of the committees and allow a very transparent and effective scrutiny of the proposal to make sure that decision makers have all of the relevant information they need for the decision making phase later on. Okay, thank you very much. That concludes my presentation on the REACH restriction procedure. Please refer back to the for the website for further details, and I'll now hand over to my colleagues at ANSES who will talk you through the proposed restriction on substances in single-use baby diapers in more detail. Thank you very much. Bye.
Hi, my name is Céline Dubois. I'm a chemical engineer at ANSES in the risk assessment department. And today I'm going to present the restriction proposal on formaldehyde, dioxin, furan, PCBs, and PAH in single-use baby diapers. So this restriction proposal will be divided in 8 parts. The first one, we are going to speak about substances and articles targeted in this restriction proposal. We are moving forward with the concerns about this substance and groups of substances. We are going to talk then about the risk assessment performed in this restriction proposal, the baseline. We are going also to talk about the approach for the analysis of alternatives. And then my colleague Karin Fior is going to talk about the socio-economic analysis, the uncertainties, and the summary, which mean the need for the restriction. So first of all, why this restriction? As you may be all aware of, single-use baby diapers are very used articles, and since the 90s, more than 90% of families in Europe have been using single-use baby diapers. And until a child is toilet trained, he will use more than 4,000 single-use baby diapers. For now, there is no regulatory framework specific to this article, and they are only subject to the general safety requirements. In 2019, ANSES undertook a study on the presence of chemicals in single-use baby diapers, as well as a human health risk assessment. And this study concluded that health risk for babies couldn't be excluded, and that there is a need for risk management. Then, France performed an RMOA and published it in July 2019, concluding that existing regulatory measures are insufficient to address this risk, and that the most efficient regulatory option is the introduction of a new restriction entry in the Annex 17 of the REACH regulation. The fourth point is that it's difficult for now to avoid exposure to chemicals in single-use baby diapers, and most of the children and babies under the age of 3 will wear single-use baby diapers. And for now, there is no information for the consumer on which chemicals are present in these articles. All this point together led France to perform a restriction dossier, and on this slide you will see the proposed restriction, meaning the substance covered by this restriction and the article covered too. On the left side of the screen you will see the substance covered, meaning formaldehyde, 17 PAH, the PCBs, meaning including non-dioxin-like and dioxin-like PCBs, 7 PCDs, and 10 PCDF. On the contrary, fragrances, volatile organic compounds, and pesticides are not covered by this restriction. When we're talking about articles covered by this restriction proposal, we're talking about single-use baby diapers that are disposables, which means traditional baby diapers, diaper pants or training pants, night diapers, and swimming diapers. On the contrary, reusable diapers and incontinence diapers that are covered by the medical devices regulatory framework are not covered by this restriction. So the restriction is about the substances on the screen, and you can see all the concentration limit proposed by this restriction. So for formaldehyde, the concentration limit is proposed is 0.21 milligram per kilogram of diapers for all the articles presented in the previous slide. The concentration limit for the sum of the quantified PCDs, PCDF, and DL PCBs is 10 milligram TOQ per kilogram of diapers. The concentration limit for the sum of the quantified PCBs is 4.9 10⁻5 milligram per kilogram of diaper. The concentration limit for the sum of the detected or quantified PAH is 3.7 10⁻6 milligram TOQ per kilogram of diaper. And we propose that this restriction shall apply 24 months after its entry into force. So what about the concerns of these substances and groups of substances? So on this slide, you have the most important concerns about each substance or group of substances. So as you may be aware of, PAH are known to be mutagenic and carcinogenic. The most important concern for formaldehyde is dermal irritation and sensitization, toxic effects in the tissues of direct contact after oral or dermal exposure, mutagenicity and carcinogenicity. Regarding dioxin and furans, the most important concerns are about carcinogenicity, effects on reproduction, hepatic, immunological, neurological, metabolic, and endocrine effects. And when we are talking about dioxin-like and non-dioxin-like PCBs, the most important concern are dermal irritation, carcinogenicity, reprotoxic effects, hepatic, immunological, neurological, metabolic, and endocrine effects. So another big part in a restriction dossier is the risk assessments. So on the next slide, you will see the approach that we followed. So as you can see, all substances in the scope have been quantified or detected in single-use diapers, implying potential exposure of children and babies. We followed an unusual risk assessment approach like the one described in the NRC in 1983 in 4 steps. So the first one is about hazards. The second one is about defining a dose-response relationship. And the third and fourth ones are about exposure and risk assessments. For the first step, the hazard has been established and the substance in the scope have hazards profile suggesting that exposure may cause adverse effects. What you have to have also in mind is that internal denial corrected with the oral bioavailability were used as reference doses. And we decided to limit the share allocated to baby diapers to 10% of the DNL and the DML. Regarding the third and the fourth steps, the parameters needed to perform exposure assessment were for most of them available, which led us to perform a quantitative risk assessment. And that all this point together led us to calculate concentration limit for the youngest class of age, meaning between birth to 6 months old, to be the most protective. And this so-derived concentration limit will then cover all categories of ages and sizes of diapers available on the market. So as a reminder, you can see on the slide also the proposed concentration limit that should aim at preventing adverse effects in children and infants, likely to be associated to the exposure to chemicals contained in single-use baby diapers. On the right side of the screen, you can also see that we have highlighting while performing the risk assessment some uncertainties. And the most important one is that we have a lack of an harmonized analytical method, but we proposed an analytical method considered to be representative of the reality of use. And what is very important to notice is that we hope that public consultation may give us more information to fulfill these uncertainties. Another part of restriction dossier is the baseline, meaning what will happen if no restriction is performed. That for now, we have to know that geographical boundaries for the assessment are the countries of the EEA 31. Voluntary action and label exist, meaning that they can be effective and help to achieve public policy aims, but that they are not regulatory schemes. Diapers consumption has constantly grown since the 80s and will continue to grow, or at least stay as it is for now. We assume that 90% of the European children and babies will wear only single-use baby diapers, which represent roughly 14 million of babies and infants. So all these points together led us to conclude that disease linked to the chemicals of concern in single-use baby diapers will steadily increase over the time. Part of a restriction dossier consists of the approach of the analysis of alternatives. So as you can see, substances in the scope are not voluntarily added to single-use baby diapers, and there seem to be contaminants for most of them. So the first part of an analysis of alternative is the identification of possible contamination sources and critical steps. And in the three blue boxes, you can see the most important contamination sources and critical steps identified in this analysis of alternatives, which is about raw materials. So we identified cellulose, nonwoven, and glues as possible contamination sources. We also identified bleaching process of the raw material as a possible critical steps, and temperature in the process as a possible critical steps too. Finally, pigments and wetness indicators have been identified as possible contamination sources for dioxins and furans. So after having identified possible contamination sources and critical steps, we proposed preventive action, alternative materials, and techniques to remove contaminants. So in the six green boxes on the slide, you can see the most important preventive action and alternative techniques to remove contaminants. So this is about better selection of raw materials, further controls of raw materials and single-use baby diapers. We propose to substitute glues to have a better indoor air contamination, to remove wetness indicator and pigments, and to use a totally chlorine-free pulp, which will help to prevent contamination from dioxin and furans. On the right side of the screen, you will also see that there is uncertainties while performing the approach of analysis of alternatives, meaning we have a lack of data for some possible contamination, for possible sources of contamination. We have a lack of data also on possible alternatives, and we hope that the public consultation may bring additional information. So thanks for your attention. I will now let my colleague Corinne Fior take over.
Hello, I am Karine Fiore. I am a socio-economic project manager at ANSES. So regarding the socio-economic analysis performed within the preparation of this restriction proposal, we made a semi-quantitative assessment for the cost. The approach regarding the substitution cost is unusual since chemicals of concern in the scope here are mostly contaminants. That is to say that they are non-intentionally used in the process and in the products. So our assessment mainly focused on the technical measures necessary for the industry and the market players to comply with the restriction. We assessed semi-quantitatively these costs. For example, we assessed the cost for the raw material selection, the changes needed technically on the process, and for example, also the costs of further controlling temperatures and audits along the supply chain. We haven't put all the figures we assessed regarding the cost on this slide, but just a few of them are presented here for your information. For example, we assessed the cost of moving from ECF to TCF materials of between 200,000 euros and 400,000 euros per year per company, plus extra investments amounting to around 1 million euros. The costs for further controls of temperatures are considered insignificant, and the cost of further decontaminating indoor air are really broadly estimated in the millions of euros per production plant. Our conclusion is that industry has already implemented many changes since 2019, since the French RMOA has been published. Therefore, we think that many costs are not due to the restriction itself, but are already borne by industry. Also, the cost assessment is mainly indicative since they will heavily depend on actions industry will actually opt for. There is quite high uncertainty regarding these reactions, and we actually don't really know what technical measures will be implemented actually by industry. Industry claim that at least 2 years would be needed to implement the remaining compliance changes and adaptations, and this is why we proposed 2 years as the transitional period. And as I've already said, this assessment of cost is surrounding by some uncertainties, and we hope that the public consultation will help to mitigate these uncertainties. After the assessment of substitution cost, we also analyzed the testing costs that would be needed from industry to reach regulatory compliance, and especially compliance with the new concentration limits we propose. Again, I haven't put all the figures here regarding this cost, but you can find some of them as an illustration. For example, the test of raw materials would amount between 50,000 euros and 200,000 euros per year per company. The test of finished products at the end of line or at the point of sale would amount between 100,000 euros and 200,000 euros per year per company. It may happen that some extra audits on manufacturing site may be also needed, amounting to 20,000 euros per audit per year. Unfortunately, we couldn't get information about testing costs for importing companies. These importing companies are very few on the market, and we didn't manage to collect information from them. Likewise, we only got very scarce information on testing frequency. And our conclusion is that industry has already strengthened their testing practices since 2019. Therefore, many costs are not due to the restriction itself again, but are considered as being already borne by industry. Due to this uncertainty, the cost assessment regarding testing is only given as an indication. As far as enforcement costs are concerned, well, on average, all member states spend approximately 60,000 euros per restriction per year to ensure compliance with Annex 17 of REACH. But in that particular case, we consider that these costs may be a bit lower due to economies of scale with other restrictions that already exist under REACH covering the same substances. Of course, there are some uncertainties regarding these testing costs, in particular due to the lack of harmonized analytical method, and we really hope that public consultation may help to reduce these uncertainties. Finally, the assessment of cost also includes an assessment of the impacts on consumers. The average price today at point of sale of a baby diaper is between 20 cents and 30 cents. And industry claim between 2% and 10% an expected price increase of this product at point of sale due to the restriction. The industry themselves indicated that this estimate of the price increase is very rough, and they absolutely didn't justify this increase at all by any data or evidence. However, we took this price increase into account, and we analyzed the possible impacts on consumers and the distributional effects that may happen on consumers and households. Nevertheless, we also analyzed the market of baby diapers, and this is a very competitive market on price in particular. Diapers market is a mass consumption market, and given these particular characteristics and features, we think that market players are expected to most probably absorb extra cost, and we don't consider likely the price increase claimed by industry. And our conclusion is that the price increase for consumers, if any, would be moderate and only temporary. And that is why we consider that the restriction is affordable. Now, when it comes to the human health benefits expected from the restriction, we couldn't assess quantitatively these benefits because for several reasons. First of all, because there is no epidemiological study on this particular exposure source. There are no data to model the disease's occurrence in babies for this exposure source. And also there are no prevalence data and no attributable fraction available in the studies and in the literature. However, we demonstrated a risk. We are dealing with CMR substances, and some of them are also suspected EDCs. We are addressing here very severe, various and latent diseases like cancers, like fertility issues, like ED properties, and also to a lesser extent, irritation and skin sensitization. So our conclusion is that the restriction proposal may lead significant benefits for health, because 90% of European babies would be protected, that is to say around 14 million babies. This is a vulnerable population, and we also think that an action is needed due to intergenerational and equity considerations. Here is a slide to summarize the different sources of uncertainties of our proposals. There is a lack of harmonized analytical method. There are a few low-dose dermal studies. Some parameters in the exposure assessment are based on expert judgment only. Moreover, there is a lack of information regarding the possible sources of contamination, as my colleague has already said. And there is also a lack of data regarding the possible alternatives or technical measures likely to reduce this contamination. And finally, regarding the impacts and the socioeconomic analysis performed in the dossier, the uncertainties are related to the actual reactions of industry, that is to say, the actions to be implemented to reduce this contamination. The uncertainties are also related to actual costs associated to these actions and technical measures to be implemented, and also are related to the actual cost of testing with, again, a harmonized analytical method, which is not, which does not exist for the time being. And to conclude, we summarized in this slide the main conclusions of our proposal. Again, a risk has been demonstrated from the substances reminded here, and these substances pose a new wide risk. The risk restriction proposal is considered proportionate to the risk and affordable. Human health benefits, although not quantified, are expected to be significant, and the compliance costs, semi-quantified, are expected to be affordable to industry, and some of the costs are already borne by them, but of course uncertainties remain. And finally, the restriction proposal is considered effective, targeted to the exposure that causes the risk, and capable to reduce the risk to human health to an acceptable level after 2 years of entry to force. And it is considered practical and monitorable. The cost of testing, however, are uncertain, and we hope that the public consultation again may bring additional information to reduce the uncertainties. Thank you very much for your attention.
Hello, my name is Sanna Henriksson, and I'm part of the ECHA Secretariat team working on this proposed restriction. I'll be talking you through the specific information requests that are part of the consultation. First of all, you can submit any information that you consider relevant as part of the consultation. However, there are some topics on which the committees and the dossier submitted would particularly welcome information. These are the topics that have been included in the specific information request, which I will go through next. In general, we would like to remind you that it's important that if you submit information and make any claims, for instance, on the costs of the proposal, then you should provide as much and as specific evidence as possible to support this claim in order to allow the committees to assess it. Okay, so let's move on to the questions. The first question is about the sources of the substances within scope and the alternatives to reduce or eliminate the presence of these substances in single-use baby diapers. The question has several parts, so we have split it up over 2 slides. First of all, on question 1A, based on the information that the dossier submitter has obtained, none of the substances in scope are intentionally added during the manufacturing of single-use baby diapers, but instead they are residues or contaminants. The first part of this question therefore seeks to confirm whether this is the case for all the substances within the scope. Question 1B aims to collect more information about the possible sources of contamination. The Annex 15 report lists several different sources, including raw materials, glues, wetness indicators, pigments, temperature control during manufacturing, and the pulp process. However, we are interested in getting a clearer idea about which substances within the scope are likely to be contaminants from which sources. Therefore, it would be useful to clearly specify which substance or substances the information submitted refers to. Then question 1C seeks more information about what industry has already done to reduce the contamination in single-use baby diapers to date. Question 1D is about what can be done to further reduce or prevent the contamination. In other words, what alternatives there are for industry. The question also seeks information about the costs or other impacts associated with these alternatives. If you have information about the costs, then please clearly specify whether the reported costs are one-off costs or annual costs, whether there would be also any savings, and if known, how many companies would be affected by such costs. Okay, question 2 seeks information on how industry would respond if the proposed restriction enters into force. Here, we want to get a better understanding of how many companies would need to undertake what additional efforts to reduce contamination by the substances within scope to the concentration limits proposed. The question also seeks specific information about the associated costs and other impacts to the companies themselves, their supply chains, consumers, alternative raw material providers, or any other relevant actors. Again, if you provide information on costs, then please be as specific as possible, providing a breakdown of any costs provided. Okay, the third question relates to various assumptions on costs and proportionality in the Annex 15 dossier. And the purpose of this request is to collect the necessary information to robustly evaluate the costs outlined in the dossier. It's quite a long question, so again, we have divided it up over several slides, and we'll go through it sub-question by sub-question. So first of all, question 3A is about the suggestion in the Annex 15 report that cellulose pulp manufacturers may potentially adopt total chlorine-free pulp bleaching processes in order to limit the production of chlorinated dioxins and furans. However, it's not clear from the report whether this would actually be a feasible solution, given that it does not fully eliminate the quantity of chlorinated products in pulp. Therefore, this question aims to find out whether companies would actually be expected to move from elemental chlorine-free to total chlorine-free pulp in order to comply with the restriction. And if so, how many companies would be expected to do so? Secondly, the question seeks to find out whether the cost estimates in the Annex 15 report are accurate. If there are any additional costs or savings, then please provide information on these as well, and preferably with quantitative data if possible. Okay, the second part of question 3, so 3b, is about the possibility to reduce as far as possible the presence of outside air pollutants indoor by further decontaminating indoor air. On this one, the Annex 15 report contains only limited information, but states that a broad cost estimate would be in the millions of euros per production plant. The question here on the screen seeks more information about whether such a measure is likely to help industry to comply with the concentration limits proposed, and also to get more specific information about the costs for this measure, including how many production plants would incur these costs. Okay, question 3c is about the testing costs that industry is expected to incur due to the proposed restriction. Testing costs are assessed in the Annex 15 report based on information provided by industry. However, the dossier submitter considers the information uncertain because they say part of the costs seem to be already borne by companies and cannot be attributable to the restriction itself, while other costs lack specifications on what exactly they include. Because of this, this question seeks more specific information both on the current testing practices and costs, and on the expected incremental testing costs specifically associated with the proposed restriction. Furthermore, we seek information on how many companies would incur such incremental testing costs as a result of the restriction. Then at the bottom of the slide, question 3D seeks information on whether the diaper market is expected to grow or stay as it is now in the future. Question 3E is about impacts on consumers. The first sub-bullet point is regarding whether the proposed restriction is expected to result in any consumer surplus loss, and by which we mean a loss of utility for consumers buying single-use baby diapers. Here, the Annex 15 report states that one way of reducing contaminants in single-use diapers could be to remove so-called wetness indicators and pigments, because these are considered a potential source of contaminants. However, the impacts of such a move on consumers have not been assessed. And therefore, the question in the first bullet point seeks any studies or any other information available on how valuable consumers consider wetness indicators, pigments, or other functional additives in diapers that may need to be removed to comply with the proposed restriction. The second bullet point is regarding whether increased production costs as a result of the proposed restriction would be expected to be passed on to consumers. If you have information about expected price increases for single-use diapers, then please specify to the extent possible how much it would be, and also please justify the increase based on the information provided about the incremental costs to industry. Question 3E is about the two restriction options presented in the Annex 15 report. In case you have any information about how the costs and benefits of restriction option 2 would compare with those of restriction option 1, i.e. the proposed restriction, then please submit them as part of this question. Okay, moving on to question 4, which is about data on exposure and adverse effects. The Annex 15 report does not contain in vivo studies on dermal absorption, nor epidemiological studies on dermal as the main route of exposure. And so for this question, we would be interested in any human or animal biomonitoring data regarding the exposure to hazardous substances via baby diapers. We would also be interested in any human or animal data on adverse health effects following exposure to the substances in the scope, via baby diapers. And here, for this question, it should be noted that skin allergies or irritants are not relevant for this dossier, given that skin sensitizing properties in substances in diapers are already covered in another restriction proposal. Okay, question 5 is about analytical methods. And for now, no standardized analytical method is available based on urine simulant. Considering that companies, laboratories, and enforcement services will have to develop this new analytical method, the dossier submitter has proposed a transitional period of 24 months for this restriction. And for this question, it would be helpful to know more about any methods that can be used to measure the substances in scope in diapers or other comparable products. Also, the question seeks information about how long it would take to develop a validated and standardized method with the required limit for this proposal. Finally, the last question, number 6, is about the approach used for the risk assessment in the Annex 15 report. And it seeks comments on the values used for the parameters for risk assessment, as well as the studies that would support the possible choice of other values. It also seeks comments on the effectiveness, appropriateness, and reliability of the extraction procedure and the urine simulant method to extract chemicals from diapers. Okay, so to close this section of the presentation, I'll address what happens with the comments that you submit through this consultation. The non-confidential comments are published on our website, which we update with new comments approximately once a month. And all comments, so both the confidential and the non-confidential ones, are considered closely by the dossier submitter, which in this case is Furans, and also by the committees. If the content is significant, then it will be addressed in the opinion of the committees and or in the background document, which is basically the Annex 15 report as it gets updated throughout the opinion making process. And then at the end of the process, we will publish the responses from the dossier submitter and the committees to the non-confidential submissions. That closes my part of the session. Thanks a lot for your attention.
Thank you very much, Sandra. Now that we know more about REACH restrictions in general, and we got some background on this particular restriction, as well as an overview of the information that we would actually like you to submit, we will go through how you can provide us with that information. Now, in order to submit your information, you can either follow the link that you see here, or you can go to the ECHA website, where you will find in the top header a tab called Consultations. Once you click on that, you then see this little window, this little link here called Restriction Proposals. And once you click on that, then you come to this page, which is called Submitted Restrictions Under Consideration. There you will see an entry for substances in single-use nappies. You click here on Details, and then you're forwarded to a page that's called Substance Details. There you can actually access the restriction report, various annexes, and additional information, but this is also where you can give comments. So go ahead and follow the link, give comments here, also highlighted in red here. Then you will come to the form, the web form, where you can actually provide the information. But before you do anything further, you should take note of these two documents that are linked here. There's one more general guidance for consultations. In particular, if this is the first time that you do provide information, it's a very good idea to take a look. There's detailed explanations of how to go about providing us with information. And then there is an information note that's customized for this particular restriction. So there you find, again, some more background information about this restriction proposal. You then need to make sure that you tick the box that says that you've read both of those documents. And then you can start actually filling in the form. And once you do that, you see that there's a couple of different sections. First of all, there's a section 1 and section 2 where you provide personal information as well as information about your organization. Then in section 3, you can provide general comments on any aspect of the restriction proposal. And then there's also some specific information requests where you will find questions that we would ideally like you to answer. Now, once all of that is done, you can go forward to section 4 and 5, where you can provide attachments. It's always a good idea to provide supporting documentation for anything that you submit to us that will enable us to do our job much better. Section 4 is for non-confidential attachments that we can also share with others, where section 5 is for confidential attachments. Well, we are almost at the end here. Please do keep in mind that your submission cannot be saved as a draft. You cannot come back to it at a later point. So when you start filling it in, make sure that you're fully prepared. You have all of the attachments that you need to provide us with handy, because you will not be able to just save it, go and come back at a later point. Also take note that there you will be provided with a submission number via the email address that you provide to us under your contact details in section 1. So whenever you want to communicate with us regarding your submission, then please make sure that you refer to this submission number. It's also not possible for you to actually retrieve your submission at a later point. So if you would like to have record of it, do make screenshots and print them out for your reference. And once you're done with everything, please make sure that you don't forget to hit the Submit to ECHA button at the bottom. And that's it. Thanks a lot for your attention, and we're looking forward to your questions.